Bismillah ar-Rahman ar-Rahim. A new presentation about patient identification. This is Dr. Muhammad Farid Tabib. It's a very critical subject we will explain tonight. We will discuss it with each other, and the objectives will be like this. We will talk about some definitions related to patient identification. We will talk about the policy itself, policy statement, purpose of the policy, the scope of the policy, related standards to patient identification, the rules and responsibilities of the staff related to patient identification, the procedure itself, the steps, how to identify a patient, and how to monitor the patient identification inside your facility. So what are the definitions we have? We have the definition is a carer who is a family member or a paid helper who regularly looks after a child or sick, elderly, or disabled person. So if we have a child, we have an elderly patient, we have a comatose patient, we have a sick patient, we have a disabled person, we have to have someone taking care for him. We called him the carer. Number two, ID band or wristband or a bracelet, the name given to the encircling semi-permanent straps. Those are some straps provided to all patients and worn on the wrist. We put them on the wrist or sometimes on the ankle or on both, as we will discuss later on. For identification purposes, we will put it to identify the patient. So who's the guardian? A person who has the authority and responsibility to make decisions concerning the personal and the physical care of the person with a disability, including health care decision and living arrangement. So someone who will take care for the patient, not the carer. This one have the legal responsibility and the authority for taking care for the patient and taking a decision for him. The patient's full name, refer to the patient name to the fourth name level. Sometimes in some policies it's up to the third name, but we prefer fourth names because it's resembling each other. We have a lot of patients, they have the full name, first, second, and sometimes the third name is exactly the same, so it's better to make it fourth level. The hospital will utilize all effort to get the name to the fourth level. Example, Ahmad Muhammad Saeed Al-Hamad, because we will find a lot of Ahmad Muhammad or Ahmad Muhammad Saeed, so Al-Hamad and Saeed and the fourth name could identify the patient. This definition applies to all patients, excluding newborns and neonates. We have another time of naming the patient. If we have a newborn or a neonate, we will call them or identify them with another way. We will mention it later on. Two unique patient identifiers. When you hear this in our discussion, this refers to Ministry of Health MOH patient identification process using at least two patient identifier, two different ways to identify patient. And we will specialize here two things, which is the patient name for level names and the medical record number. So we will identify the patient with many identifiers, especially we are focusing on the full name to up to the fourth level and the medical record number or MRN. What's the policy statement for patient identification? All patients must be correctly identified and matched to their records. Investigation, procedure, requests, prescriptions, results, and all other documentation. Every single process inside your facility, you have to identify your patient whilst being assisted or undergoing procedure or treatment within the MOH facility. Whatever it is, a hostel or a PHC or a center, we have to identify all our patients through this policy. All inpatient and certain other patients mentioned in the policy must wear at least one ID band. So every patient admitted to the hospital, we have to put him to supply him or to put one ID band on him. At least one ID band. Sometimes it will be two ID bands, and we will explain it later on. And this is for only the safety of the patient. The management and the monitoring of the patient identification is an ongoing process. We will identify the patient in all the process inside the facility, from registering to consulting to investigating to prescribing a medication, even in the discharge, we have to identify the patient. It should be a continuous process, not only in a simple part of the care process. The patient room and the bed number must never be used, never ever used the patient room number or the bed number to identify the patient, because it could be changed. The patient can change his room, can change his bed without telling anybody, so we will never use one of them or both of them in identifying the patient. The use of the wristband does not remove the individual clinician's responsibility for checking patient identity. So when there is a staff coming to give a service to the patient, he will not depend on the wristband only. He has to identify the patient through talking with the patient or his guardian or the staff to identify the patient in a correct, proper way. Especially before administering medication or treatment in line with existing policies, including policy for consent, policy for blood transfusion, and policy for administration medication. So the patient identification policy should be matching with the consent policy, with the blood transfusion policy, with administration of medication policy. What's the purpose of patient identification? Patient identification is a vital component in maintaining patient safety. It's a very critical issue for keeping the patient safety. Therefore, correct patient identification and the application of patient wristband is an essential part of this process. The purpose of this document is to ensure that the accurate identification of the patient by providing guidance to minimize the risk of patient harm as a result of misidentification. As we know, there is a big role of misidentification in central events and reportable events. A lot of central events is happening because of miscommunication between the staff, and the misidentification also plays a big role in risk of the patient and patient safety, especially central events and reportable events. So we don't like the patient to have a central event or reportable event, so we have to focus on patient identification. What's the scope? This policy and the procedure apply to all patients receiving treatment or services at any MOH facility, and this policy also applies to all and every single staff involved in the patient identification, including the staff if he's permanent or visitor or locum or even resident. So the scope is applied to all healthcare givers and all patients. No exceptions. What are the related standards, regulation, and policies related to the patient identification policy? SIPAHI 3rd edition, Saudi Central Board for Accreditation of Healthcare Institute. There is a standard QM17 in quality domains. It states that patient identification should be done in a proper way. Again, OVR report policy, any deviation from the policy should be registered as OVR. Reporting and investigation central event policy and the procedure disclosure policy also, they are matching with the patient identification policy. Rules and responsibilities. All healthcare staff who are involved in any aspect of patient's care should receive education in the application and the implementation of this policy and the procedure, how to implement it in a proper way. It's the responsibility of all healthcare giver, clinical or even admin, non-clinical, who are involved in any aspect of the care to abide to this policy with the scope of their work practice. Example, registration. During the registration, we have to identify patient correctly. In ER, in admission, during the transfer in between departments or transfer out to another facility. The policy and the procedure should be available on all care settings where the proper patient identification is applicable. I should find the policy in ER, in ICU, in OR, in the registration area. In every single department and everywhere in the hospital, I have to find this policy so I can go back to it to revise it anytime. This policy and the procedure for correct patient identification may be adapted for local implementation, but must contain the critical safety steps as outlined with this policy. So you can do some modification on this policy according to your facility, but you have to keep the main boundaries of this policy. Do not interfere with it, but you can modify only little things inside according to your hospital capability, capacity, and administrative issues. What about the procedure, which is the most important thing today? What are the steps? How can I identify patient? Where I can identify patient? How can I do it in a proper way? So the procedure, correct patient identification, starts with the patient first contact with the service, and it is the responsibility of all staff involved in admission process, both clinical and administrative, as we said before, to ensure correct details. And details are obtained and recorded at that any inquiries or any accuracies or queries are highlighted and resolved. Anything you find during the patient identification and it's considered as queries, question mark, you have to highlight it and do your best to resolve it. All patients must be able to be identified at all time whilst being assisted or undergoing procedure treatment with the organization. Therefore, all hostel inpatient must wear at least, as we said, one ID band. And this one should be accurate and a valid identity bracelet. Refer to the wristband as we said in this policy. And in some cases, more than wristband could be worn by patient. As a minimum, staff must check the patient's, as we said, full patient name and the medical record number. Date of birth can be added, address can be added, medical record number, as we said, next of kin. Staff should always use open question to establish the patient identity. When you are going to one patient to give him a service, do not ask him, are you Mr. Ahmed? Are you Mr. Muhammad? Are you Mr. Ali? Are you Mr. John? No. You have to ask him, what's your name? He have to answer you by the name, and you have to check if this name is matching with the name written in the medical record on the wristband or not. So the patient can be daisy, or he's under some analgesia or anesthesia, or he's in confusion or a coma. And if you told him, are you this person? He might answer yes, and he's not the one. So it's better to tell him what's your name and matching what he said with the documented on the medical record and on the ID band. If the patient is unable to respond due to their clinical condition, coma, analgesia, anesthesia, RTA, or the capacity identification should be verified with the family or relative wherever possible. So if the patient is unable, maybe he's young, elderly, comatose, or RTA, or traffic accident, something like this, you have to verify the name and the medical record number with the first of kin or the carer or the guardian, or even with the staff if you don't have a carer, guardian, or a family member. If the patient is unable to state their name, then the wristband must be checked by two members. As we said before, if the patient have no family member, that time we are his family. But we have to be two to do double check. So two members could check for the patient and identify him correctly if we don't have a carer or he cannot communicate with us. With the healthcare record available to ensure all details match. When initially identifying a patient, there may be a language difficulty in communicating with the patient. For example, if you have a patient, he cannot speak in English, he cannot speak at the same time in Arabic, what you will do? And you only know English and Arabic. And the patient, for example, is Indian or something, and he speaks only in English language. What you have to do? You have to get an interpreter. Get someone taking to his language to communicate with him. This requirement should be recorded on the notes. You have to record it in physician note, nursing note, anywhere in the medical record that patient cannot communicate with us. We get the interpreter, if you can put his name, from the same nationality, talking the same language, and we communicate with the patient through this interpreter. Particular care must be taken for patients with common names. If you have in your room, you are taking care for some patient, and you find patients with many patients with the same name. Like you have 2 or 3 patients at the same ward naming Muhammad or Ahmed or Ali, which is the very common names. That time you have to take more caution to those patients, and you have to put some alert like this, take care, we have more than one Muhammad here. So when you're going to anyone Muhammad, you have to do more effort to take care, to make sure that he is the wanted one, he's the desired one, he's the one need to take these services. Otherwise you can give the wrong patient the right services. For a non-patient and unconscious patients, such as trauma patient, as we said, identification is made by resuscitation or emergency staff. As we said, no family member, we are the family member. We can do it by double check by two stuff until a unique identifier came. First of kin, some relative carer, police came, and they will identify him. That time we can do the identification again. What about the unconscious patient? Patient can be unconscious for a number of reasons. Sometimes it's the treatment they are having, trauma, analgesia, sedation, but it may be due to influence of the drug. Maybe the patient is under drug or alcohol, where the patient are incapable of identifying themselves and maintaining their own safety. That time what we have to do, as we said, it's the responsibility of the staff looking after the patient to ensure they can be identified properly. All unconscious patients must wear an ID band or wristband for identification purpose. Staff must provide a unique identifier for the patient until such time as their identity is established. This number should be used for all procedure and intervention to identify the patient. For example, if you have unknown, you have to give him a code number. And as we said and discussed in some presentation before, we can tell him UK, unknown, 001, the first patient, and the date, both the date, and if you can put the word itself, you can put like ORER. So when the patient is shifted to another where, still he is unknown number 001 at that particular date, and that department will be changed, and so on. So we can, if at the same day you have 3 or 4 unknowns, every single one of them have a code number, so you can deal with them properly and you can identify them in the proper way. The senior staff responsible for the patient's care will ensure that all records are merged or when the patient identify is established. For example, we bought some forms from the medical record and we bought unknown. The patient is identified by a police or a next of kin or family member. That time you have to change your UK or unknown 00 and so on to become identified by new identity of the patient. Clinical staff must always validate that the verbal identification given by the patient or their relative match the information on the patient wristband before doing any procedure. Ask the patient what's your name. If he cannot answer, ask the family member or another staff and matching it with the medical record information and with the wristband before doing anything like extracting blood, giving any medication, doing some investigation, any procedure, any invasive procedure, even if it's not invasive procedure. The positive patient identification process should include asking the patient if they had any allergy or not. If you do not ask the patient about allergy and document it on the medical record, you did not do the identification in a proper way. Procedure requiring positive identification, the list below is not exclusive, not limited to. You have to do the positive or correct or proper patient identification on the next 9 items, not limited to this 9. You can add anything more. Number 1, a patient should always wear ID band. 2, during taking a blood sample, or giving a blood transfusion, or collecting any patient samples or fluids, confirmation of death, administering any medication, surgical intervention or invasive procedure, transfer in or out, inside the facility, out from one facility to facility, or doing any imaging for the patient like X-ray. When an internal transfer occurs between one department to one department, example from OR to ICU or from ICU to OR and vice versa, the receiving staff member should check the patient wristband with the patient, whereas the patient has the capacity to do it. You have to revise it with the patient or with the family member, or as we said before, with another to do a proper positive patient identification. Patients who are transferring in from other facility must have the receiving facility now from one facility to another facility. They have to remove the wristband and immediately put the wristband of the new hospital or of the new facility. If the patient wristband is removed or become wet or damaged or faded, or some link or leakage of the blood or fluid and it could be damaged, or it's not damaged but unreadable, we can read it, we have to document it and immediately change it and putting a new one by the nurse or the midwife taking care for the patient. Before any intervention or procedure is carried out, it's the responsibility of the staff member undertaking the intervention or procedure to check the patient identity before any intervention. Prior to administrating any medication, it's the responsibility again of the staff to check the patient identity in accordance with the facility medication management policy. When a patient is to be admitted to the theater, to OR, it's the responsibility of the member receiving the patient to check the identity in the sign-in checklist. The nurse transferring the patient to the theater and the patient health record. We have two nurses transferring one, receiving one, patient himself or family member, and the medical record. That time we have to identify our patient correctly. Wristbands must be applied in all cases so that any member of the staff needing to check the patient identity can easily access and read the information. Ideally, the wristband must not be removed until the discharge. Leave the ID band on the patient. Do not change it until it's damaged or something, or fading or unreadable, until the patient is about to become physically discharged from the hospital. That time, it's the only condition that you have to remove the wristband. What about emergency department? In the emergency department setting, there will be patient where patient identification wristband must be applied. These are as the follow. As we said before, we will put the wristband for the patient on admission, but now we can put ID band for the patient inside ER. Example, if the patient is about to be admitted and there is no bed, we will take care for the patient in ER as a ward until an empty bed is there. So we have to put ID band. 2, all patients who are streamed to emergency observation or treatment area as a major aneurysm or waiting for movement, as we said, to ambulatory or to admission, we have to put a wristband. 3, ambulatory or minor streamed patient where it's a professionally judged to be appropriate, for example, for patients who lack capacity or are having procedure sedation or block. If you will do any intervention inside the OBDs, I mean the outpatient clinic, you have to put the patient, to supply the patient with ID band, because you will give sedation or nerve block, or even you are going to do any minor procedure, you have to put ID band. But for a regular patient in the OBD, he's just coming for consultation, almost all hospitals will not do patient identification by wristband. They will do identification by the name and the biomedical record number according to the policy, but they will not put wristband. When we have to put wristband, as we said here, if the patient is undergoing sedation or analgesia or nerve block, or he's undergoing any procedure, even simple procedure like tooth extraction, like abscess drainage or something like this. In the outpatient clinic setting, it's not normally necessary for patient to wear wristband, as we said, but the exception, as we said, if the patient is undergoing sedation or if he is undergoing intervention. We have to put the patient name and the medical record number. Some hospital will add the date of birth and address. Where patient used the InTouch self-booking system, then the OBD clinical staff should validate the patient information directly with them without wristband. The reception staff will be responsible for validating the information given by the patient or his relative or the carer, and we have to match it with our HIS. If we don't have HIS, with our paper medical record, and the patient notes when available, and when necessary, their appointed card or letter. There are exceptions where an outpatient must wear a wristband, as we said before. A wristband is required for those patients who are attending as an outpatient to undergo therapy or procedure, as we said before. Patients who return for regular assessment for anticoagulant therapy must have their full details checked against the facility HIS, their patient notes and the therapy card and the specimen request from form and the specimen bottle before the sample is obtained. If there is a sample, you have to do double check and again correct patient identification. Exception to the application and removal of the patient wristbanded. There are some rare and exceptional situations where a patient cannot wear a wristband or the wristband needs to be removed. We will discuss it later on. When patient We have to put an ID band, but the patient's condition cannot be capable to receive an ID band. What we will do, we will explain it in the next slides. When a patient is incapable of identifying themselves, verification of identity should be made by asking the carer, as we said before, and matching it with the medical record. Let's go for the wristband details. The information on the patient's wristband will be checked with patient, carer, relative, and health record prior to application. The patient wristband should contain the following information. As we said, two main things, which is the patient full name and the medical record number. Some hospital will add the unit number and date of birth. Application of wristbands. Patient must be given a clear explanation. We have to explain to the patient why we are using the wristband, how he can keep the wristband clean and integrity of the wristband. So clear explanation of the importance of the wearing wristband. It's for your own safety, for their own safety at all time during their hospital stay or outpatient attendance, and their consent gained. If the patient is confused or unable to respond, the same explanation should be given to the relative or carer for the patient. The patient wristband should be placed on a dominant wrist. Right-handed, left-handed, we will have to put on the dominant wrist. If the arms are both swollen or injured, or we can put them on one wrist, we have to shift it to one ankle. If the patient limbs are too large, so it's not suitable for him to put one ID band, we have to connect or communicate two wristband and put it to the patient. If the patient is unable to wear a wristband either due to their clinical condition or treatment, an alternative method for identification should be sought whatever possible. For example, if you cannot put any wristband or ankle band for the patient, you have two choices. Choice number one, put a strap on his body with a transparent sticker so anyone can identify the patient from it, or you can take a photo for the patient, of course after permission of the patient, and you can identify the patient through his photo. The patient wristband should be applied to be comfortable but secure enough. So don't put so tight to hurt the patient, and don't put so loose so it could be lost from the patient. In case of absence of the patient representative who knows them well, the identity bands of the patient who cannot confirm their own identity, as we said before, young or elderly or unconscious or confused, must be checked by two registered nurses or midwife. As we said, if the patient have no family, we are the family. Where a patient is unconscious and unaccompanied by anyone, and there is no possibility of positive identifying the patient, the information will be taken from the health record, and we can call the patient if we don't have a medical record for him. We can use the medical record itself. The patient wristband must contain the following information, as we said before: unknown, male, female, and the unit number we are putting the patient in this unit. The patient wristband shall only be removed when there is entire discharge. As we said, patient is ready for physical discharge. If a patient refuses to wear the wristband, the patient should be advised of the associated risks. Tell him the risks of not putting the ID band. The discussion and the reason should be documented in the medical record in anywhere according to the hospital policy. Exception to application of ID band. There are some rare and exceptional situations where the patient cannot wear ID band. So what to do? What are the conditions and what we have to do? Clinical condition or treatment, example, intravenous access line or dermatology problem and treatment. Refusal by the patient. Allergy to the material of the wristband. If and when such a situation arises, it's important that the staff assess and manage the associated risk for correct identification of the patient. This will include, after patient relative consent, photographic documentation or identification can be done. Discovery of patient wristband. For example, if a staff is doing her job as a nurse or a physician, for example, and they find some patient without a wristband, what they have to do? Any member of staff discovering the patient without wristband should assume responsibility for correctly. He's the one, it's the responsibility for him to report and help in putting a wristband for this patient. Primarily, it will be either nursing or midwife staff or support staff who will be responsible for generation and application of the patient wristband. However, it's the responsibility of all staff to check the validity and the accuracy of patient identification before giving any services to the patient. When to remove, how to remove the ID band. Where is a wristband is removed, it's replaced immediately. When you remove someone because it's faded or damaged or something, immediately put another one and they make sure that the information are accurate. For infection control purposes, identification band should be changed if it's become visibly soiled, otherwise they are not be at risk. Where it's necessary to remove the patient wristband, for whatever the reason, it's the responsibility of the member of staff removing the wristband to ensure that it's replaced immediately as we did before. How to identify newborn and neonate? Neonate, two identification bands, two bands have to be put on the neonate and newborn. Are put on the baby immediately after birth. One on one arm and the other one on the other leg. One on arm, one on a leg. The ID band must also include the mother's name. This should state baby boy, baby girl of, but the name of the mother. So two ID bands, one on the leg, one in the arm, on the wrist, and both baby boy, baby girl of, but the name of the mother. The baby must have the mother's name and not the father's name. Of course, because the mother is inside in the hostel, so identification of the neonate by mother's name, not father's name. Identification band should be checked with the parents prior to being attached and again each day. When the mother is coming to feed the baby, when the father is coming to check for the baby, we have to identify and check the wristband every day, not to mixing the baby with each other. If the baby needs to be taken into a different room, for example, as we said for lactation or ICU or any other way, example for blood sample to be taken, the identification band should be checked with the mother prior shifting the baby from one ward to one ward, from one session to another session. What about psychiatric patient? We cannot communicate with them. We cannot take a proper information from them, a correct information of them. If the patient's mental state is adversely affected by having a hostile armband fitted, photographic identification. If the patient is quiet and he's not removing or destroying the wristband, we will put the wristband. But if we cannot, we will take a photograph for the patient, and every time we are giving services to the patient, we have to check the photo itself. The identification of a body, if he's deceased body, dead body. Deceased patient, all deceased patient must be correctly identified within two identification bands, exactly like the newborn. One is attached to the wrist and the other one is attached to the ankle, not like leg for the newborn. So two bands, one in the wrist and one in the ankle. If limbs is missing, if, for example, road traffic accident, he have no limb, no hand, for example, no wrist or no ankle is missing, then attach one label to the available limb and the other one to the patient's skin, abdomen or chest or back or something with a transparent tape as we said. Identification arising from death in the community or in the emergency room requiring identification will be dealt with this in the proper way. All deceased patients must be properly identified with two identification bracelets, one on the wrist and one in the ankle. This is for all dead bodies. Should a patient not have an identity bracelet, it's the responsibility of the nursing staff from the transferring ward to put it. If the event of the patient's name not being known, we will put marking him unknown male and female as we said before. Notification of death, certification of death or notification of death. One copy of the notification of death card must be taped securely to the shroud, which is the closest around the dead body. The second notification of death card must be taped securely to the outside of the sheet or body bag. So we cannot confuse, confuse between the dead body. Reception of the bodies in the mortuary. Now we will talk about the mortuary. Bodies from within the hostel. If the dead body coming from the hostel, the porter must ensure that an ID label is attached to the outlier sheet covering the body by the ward nursing staff before transferring from the ward to the mortuary. The identification of the bodies form within the hostel must be thoroughly checked on arrival at the mortuary by the porter or caretaker, who must examine the ID band for the name, ward, date of birth. A body transfer sheet will have been tabbed by the ward to the shroud, as we said before. When the body is moved from ward, the porter will be responsible for placing the body into a refrigerated store, labeling the door outside the refrigerator of the fridge, and registering the body within the mortuary register. Procedure to be followed in case where misidentification occur. What if we have misidentification? For example, you are asking the patient, what's your name? He said, my name is Ali Ahmed Ismail. And you saw that the wristband, the name is written is Hussein Muhammad Ahmed. It's different. The patient, the wristband is not matching with the patient himself. What you will do? Any staff member who discover any deviation from this policy must complete the facility of OVR. You have to put occurrence variance report form in accordance with the facility OVR policy. If an error occurs, for example, the patient received the wrong medication or the wrong investigation or procedure are carried out or an incorrect result is reported, all appropriate action must be initiated to resolve this problem and to correct it. And if there is a sentinel event happen, you have to report it and starting your root cause analysis. But before, you have to save your patient. An instance of misidentification, particularly where patient have received unwarranted treatment, will be fully documented in the patient medical record. You have to document in the patient record what happened to the patient, what you did. How to monitor patient identification in your facility. Compliance with the policy will be monitored by clinical director, medical director of the hospital, relevant units such as admission office, support from quality department, especially patient safety and risk management department. You have to do analysis, trending, numbers by month. For example, this month we have no identification. This month we have two misidentification. One, it was in that ward, and this one was in OR. And what we did, are we increasing? Are we decreasing? Are we zero level? What improvement should be done? You have to do it. And should be discussed in a department meeting and the quality patient safety committee. Discuss in the department meeting in the concerned department. And of course, you have to collect all those events and discuss it in the quality and patient safety committee. By that, we finished our presentation. Until we meet again, thank you very much. Assalamu alaikum wa rahmatullahi wa barakatuh.